Hello guys, welcome to the channel. And in this section I'll try to cover uh, a minor chunk of bacteriology, microorganisms like Yersinia, Salmonella, Shigella and Vibrio. I will just try to compile everything and all the important and exam related facts within 40 minutes. I will try my level best and just one more thing I'm just repeatedly saying in my videos for a while now, like whenever you try to watch into the channel the dopodoc, it's completely for revision companion purposes and not as a primary source of information anything. So just go through your notes 2 or 3 times and then you can just come here and you can just hear what I'm saying. Just hear once what I'm saying and whether you just recall along with me the facts or maybe the concept. Just recall along with me. If you get stuck somewhere, just pause the video then and there itself and go to your notes and just clear it up then and there. Okay, so let's get started. So first bacteria is the Yersinia, and before that we are starting with the actually we are Enterobacteriaceae family. We already saw that the Edward and Ewing classification EE, and under the Edward and Ewing classification we have Escherichia. So Escherichia has E. coli and Shigella, and Edward Ciela, and E. tada, and Salmonella only, and Citrobacter diversus, Citrobacter fraude, Klebsiella serratia, H. alveoli, Enterobacteria cloacae, and Providencia agglomerans, and Proteaceae, Providencia, Morganella, and Yersinia enterocolytica, Yersinia pseudotuberculosis, and Yervinia herbica. This I just given different organisms classified under the Edward and Ewing classification. The important ones being Escherichia family, E. coli and Shigella, Salmonella separate family, and Citrobacteriaceae, Citrobacter diversus, and Citrobacter fraude. Okay, so that is an important there. And Klebsiella we already studied, and Proteus also we can easily guess from the question itself. It just says Proteus, Providencia, and Morganella. Yersinia pestis. This is the most common mistake I want to stress here. Yersinia pestis is not classified under Yersinia. Okay, it's a miscellaneous, now classified under miscellaneous bacteria only, and under Yersinia we have Yersinia enterocolytica and Yersinia pseudotuberculosis. Okay, that's it in this thing. And starting with the Yersinia, so Yersinia pestis, as I've said, causes the plague. It's a miscellaneous bacteria. Yersinia enterocolytica and Yersinia pseudotuberculosis both causes yersiniosis. Yersinia pestis, it doesn't have any relationship with yersiniosis. Okay, just have it as a dictum here, and this belong to the Enterobacteriaceae family. So what is yersiniosis? It is it's a group of 3 human diseases: self-limiting gastroenteritis, mesenteric adenitis, terminal ileitis, and in adults it can cause systemic diseases. So come again. So what is yersiniosis? So yersiniosis is nothing but a 3 human diseases. Like self-limiting gastroenteritis is a mild form. It can get into major severe form, like terminal ileitis in children, and in adults it can enter into the systemic forms also. Okay, then coming to the yersiniosis. So yersiniosis, how it is diagnosed? So it is diagnosed only by the stool culture only. So the motile forms are demonstrated at 25 degrees Celsius, and non-motile forms are demonstrated at 37 degrees Celsius. What is the culture here? So culture is the McConkey agar, Escherichia enterocolytica. It is a lactose fermenter. Okay, we already saw that Escherichia enterocolytica and Escherichia pseudotuberculosis only. So for diagnosing, it causes yersiniosis. So for diagnosing yersiniosis, we culture Yersinia enterocolytica. It is a lactose fermenter, and it is forms motile colony at 25 degrees Celsius and non-motile at 37 degrees Celsius, and the cold enrichment optimum temperature is 25 degrees Celsius, and even incubated at 4 degrees Celsius for 1 week, isolation becomes easier. This cold enrichment temperature is very important. Okay, it's previous year asked question. Cold enrichment optimum temperature to 25 degrees Celsius. Okay, then coming to the Yersinia pestis, this is it. Just have some words about pseudotuberculosis, Enterocoletica, so Enterocoletica, colon 3 human diseases, and Yersiniosis lab culture, cold enrichment, motile 25, non-motile 37, Mekonchi agar culture. Okay, and cold enrichment optimum at 25 degrees Celsius and incubation at 4 degrees Celsius for 1 week. Isolation becomes easier. Then coming to the Yersinia pestis, it is a miscellaneous, as I have said before. So what is happening? It is called as the plague. Okay, so what are the different types? It's a major topic of discussion now. In India, 4 different foci has been identified. In Kolar, that in Tamil Nadu, Andhra, Tamil Nadu border, TN one foci, and Beed, Latur, Maharashtra one foci, and in a Roru village in Himachal Pradesh one foci, and Uttaranchal 4 foci. So the names are not very important, but it can be asked in PSM. So the names are Kolar, Tamil Nadu, Beed, Lakur, Maharashtra, then Roru village in Himachal Pradesh, and Uttaranchal. Okay, so these are the 4 foci of the Yersinia pestis. Then coming to the virulence factor. So what is the virulence factor? Here is the protein envelope antigen F1. So F1 is the virulence factor. So heat level, plasmid coded, it inhibits phagocytosis. So this is the reason for the virulence. And VWAG antigen A is present. It's a plasmid coded. Okay, plasmid coded. Just I have a list about these types of virulence factors for all the organisms, because it's one of the recent hotspot places for the examiners to ask question. And coagulase and fibrinolysin. Okay, coagulase and fibrinolysin. And what is the toxin present here? The toxin, endotoxin, is responsible for virulence, and another one toxin is called murine toxin. It may or may not be responsible for the virulence. Okay, so this is plague is a zoonotic disease, animal to human transmission. So reservoir is obviously wild rodents. The species is Tatera indica, and the vector is the rat flea, Xenophysella Chiopsis in India, and Astica in South India, AS, so South India. Okay, Chiopsis in North India, and then spread by the bite of the infected rat flea. And the flea index. So what is the flea index? It is an PSM question. Number of fleas per rat. Number of fleas per rat, not the number of fleas per infection. Okay, life cycle. Flea gets infected, and the transmitted to the organism, blocks the proventriculus of the flea, and it regurgitates in a blood meal. The time between ingestion and blocking is called as the extrinsic incubation period. The flea bites the rat, and the organism blocks the proventriculus of the flea and regurgitates in the blood meal, and when it bites the human, it is transmitted to it. So where the organism, where it is present? It is present in the stomach of the infected flea. Okay, so time between ingestion and blocking is called as the extrinsic incubation period, and it is 2 weeks for Xenophysella Chiopsis species. What are the 2 cycles of the plague? So plague has 2 cycles. It is called as the urban domestic cycle, or maybe the wild cycle. So urban domestic cycle is directly from the rodents around. The humans are getting infected, whereas in wild, independent of the wild rodents, the humans are getting infected. So that is called as the wild form. This is called as the urban form. So coming to the plague clinical presentation, 3 types of clinical presentation: classical bubonic plague, pneumonic plague, septicemic plague. Septicemic plague can be both as an consequence, and also as an consequence of the first 2 stages, and also a separate clinical feature. So what is bubonic plague? So bubonic plague, 2 to 7 days of incubation period. So the infection starts within 2 to 7 days of incubation period, and lymph node groin enlargement and fever is present. Pneumonic plague, from the name we can say that 1 to 3 days. Always remember, except few organisms like Mycobacterium tuberculosis, most of the lung organisms have short incubation period, comparatively shorter incubation period with the other forms of the microorganisms. So it is 1 to 3 days. So this is responsible for bioterrorism agent, and Clostridium botulinum, remember, right? It is also a bioterrorism agent. And septicemic, it is also 2 to 7 days. It is characterized by black death. Okay, characterized by black death. And then coming to the diagnosis, so the diagnosis is by the stool, sputum, or maybe the buboes, lymph node aspiration, and blood and CSF. And what is the microscopic appearance? Is the safety pin appearance. So safety pin appearance, it is demonstrated by Weiss and a new methylene blue strain. Okay, Weiss and new methylene blue strain, or maybe the right strain. Okay, so safety pin appearance, bipolar staining, Weiss and new methylene blue strain, or maybe the right strain. Okay, Weiss and new methylene blue strain, or maybe the right strain. And cultures, optimum culture is at the 27 degrees Celsius and envelope at the 37 degrees Celsius. In blood agar or chocolate agar, dark brown colonies are demonstrated. Okay, dark brown colonies are demonstrated. It is due to the absorption of the hemine. And in McConkey, colorless colony demonstrated. And in nutrient bath with oil or ghee broth, stactile growth means hangs from the hanging growth from the surface. That growth is demonstrated. Okay, so blood agar, chocolate agar, dark brown due to absorption of hemine. And McConkey agar, colorless, nutrient broth with oil ghee broth. Okay, then stalactile growth hangs from the surface. Then coming to the biochemical reaction, usually now we are seeing about the IMVIC. So in only M positive, I negative, Vi negative, C negative. Okay, only methyl red only positive, indole negative, Vi negative and C negative, and catalyst negative. Yes, that is the thing. Then glucose maltose mannitol fermentation, it produces gas, it produces acid but doesn't produce gas. It is catalyst may or may not be positive, but oxidase negative. Okay, and this is important, acid positive and gas negative in fermentation of glucose maltose and mannitol. Serological test, we already saw that the F1 is the virulence factor involved here. So antibody against the F1 by passive agglutination is demonstrated. So what is the titer? So titer, significant titer is any titer greater than 128 for single sample is itself significant. Single sample 128 significant. Okay. Then coming to the isolation from the rats, the carcasses dipped in 3% NaCl is used to destroy the infected flea. Okay, then coming to the vaccine. So vaccine is the recombinant vaccine. So recombinant vaccine is RF1V F1, we saw that now. So recombinant F1 vaccine, or maybe it's a pre-exposure vaccine. And another one vaccine is the formalin killed vaccine. It is given subcutaneously, gives protection only against bubonic plague. Protection is for 6 months only. Okay, so it is made by Salkey's modification of Hafkin vaccine. Okay, Salkey modification of Hafkin vaccine. Formalin killed. And another one is the recombinant vaccine, is pre-exposure prophylaxis. This is the post-exposure prophylaxis, is formalin killed Salkey modification of Hafkin vaccine, subcutaneous, protects only bubonic plague, and protection for the 6 months. This is for the Yersinia. Then coming to the Salmonella. In Salmonella we have typhoidal and non-typhoidal. I will just revise everything. Okay, I will just have this 4 microorganisms again in a more concise and short version video. This is the maybe it's just a before step being that. Okay, so that the more we repeat, the more reinforcement of the facts we get. So that is the main concept behind it. And then starting with the Salmonella. So Salmonella is 2 forms, typhoidal and non-typhoidal forms. So we have a Kaufman and White scheme under this. So in Kaufman and White scheme, serogroup A, serotype paratype Salmonella paratype A. Serogroup B, Salmonella paratype B, and Salmonella typhimurium. So typhimurium and paratype B, both under B. And in C1, this is the twist here. C1 we have Salmonella paratype C, and in C2 Salmonella mucin. Okay, no C here, only for C1 only C, mucin for C2, and for D Salmonella typhi and Salmonella enteritidis, very clinically important organisms. Salmonella typhi and Salmonella enteritidis, and Salmonella E2 for anatom. Okay, anat E2, E grade in anat. So Salmonella anatom. So what are the antigens? So antigens is the O antigen, somatic antigen is the heat stable antigen, H antigen is the flagellar antigen, and VI antigen is the heat labile antigen. So only O somatic, so S for stable, heat stable, H flagella, 3 L's are there, so obviously it is heat labile. Okay, labile L, VI and H. So 3 antigens are there, O, H and VI. Any Vidal test titer has these 3 titer interpretations only, but the titer values differ in various labs according to their own kit and their own settings. So H and V1 is an flagella. Even if you get confused, just remember H and VI is present in flagella only. So flagella means heat level, whereas O outer cell wall. Cell wall means somatic. So yes for heat stable. Okay. So what is the O antigen made up of? So O antigen is made up of polysaccharide, protein. Okay, so polysaccharide and protein complex. So it is extracted from the cell by trichloroacetic acid. Okay, it is done by bovine, so it is called as the bovine's antigen. So trichloric acetic acid extraction of the O antigen is demonstrated by bovine, so it is also called as the bovine antigen. So yes, O antigen, it's a comparatively and less immunogenic form. When on reaction with the anti-sera, it produces a slow chalky granular clumps are produced here. Okay, slow chalky granular clumps are produced here, whereas it's a less immunogenic form. Whereas the flagellar form H, it is the more immunogenic form. It produces fast, loose, fluffy clumps. Flagellar, okay, fast, F fast. Yes, somatic, heat stable, but slow. S for slow. Because of the slow, it forms granular chalky clumps. But flagellar fast, F fast, loose, fluffy clumps, flagellar. Okay, then coming to the vaccine. So vaccine VI form, usually we develop a vaccine because the VI envelops O antigen. For this is the reason in it will not agglutinate with the even the antigen O antigen is present, it will not agglutinate when anti-sera O is given, because the VI antigen covers, or maybe the it covers completely the surface of the O antigen without itself, it makes it hides the O antigen. Okay, then coming to the O antigen. O antigen is same for ST, SPTA and SPTB, and whereas H antigen is different for three strains. Okay, Salmonella typhi TH forms, Salmonella typhi paratyphi AH, Salmonella paratyphi BH, everything is different, but the O forms are same for Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B, but it is different for H antigen. Because of that reason only it is more immunogenic, whereas the somatic is less immunogenic. Then coming to the antigenic variation. So antigenic variation H2O, loss of flagella, it changes the antigenic variation from H to O. So this Salmonella typhi, this is given by 901O. Okay, so coming to the antigenic variation, it's a very important topic of discussion. So V to W variation, VI antigen to W variation is the loss of VI is there. So even under the loss of VI, it won't agglutinate with VI. Okay, whereas the VI antigen is agglutinable with anti-serum, whereas when the VI is changed to W, it won't agglutinate with the VI serum. In that case, we can confirm the antigenic variation. So some intermediate forms of VIW is also reported. It depends. It responds to it shows variable response to this anti-VI anti-serum. Then coming to the antigenic variation, smooth form yes, rough form, or loss of O antigen, there is loss of virulence. Okay, so we saw about the HO. Three variations we saw, HO Salmonella 901O, VW, and then SR smooth to rough. It also marked by the loss of O antigen. Okay, loss of O antigen. When H is changed, that is 901O. When VI is changed, VI to W is changed, it is that agglutination, that forms we discussed now, that is that. Then coming to the clinical features. So Salmonella typhi classical clinical features, it is the enteric fever, typhoid, and Salmonella gastroenteritis, non-typhoidal Salmonella, and Salmonella septicemia. These are the three clinical features under Salmonella. Then coming to the enteric fever. So enteric fever we have caused by Salmonella typhi, paratyphi A and paratyphi B. And coming to the pathogenesis. So pathogenesis mode of transmission is by the fecal-oral route of transmission. Infective dose is 10 power 3 into 10 power 5 bacilli. It binds to the M cells, microvilli. It penetrates the submucosa. Okay, it binds with the M cells. That is very important here. And Okay, then coming to the infective doses, so there is a small extra point I would like to add. Just is slightly deviating away from the enteric fever infective dose. Here we saw the infective dose for enteric fever is 10 power 3 to 10 power 5 bacilli. But in Escherichia EHEC, Escherichia E. coli hemorrhagic form, we saw the infective dose to be 10 to 100 or maybe less than 100. Whereas in other organisms having low infective dose is the Cryptococcus, Entamoeba histolytica, EHEC, Shigella, and Giardia lambia. This is also important here. Okay, this is also important. And then coming to the Salmonella, it invades the mucosa, submucosa. It resists the intracellular killing, thus making it very clinically significant. Okay, it resists intracellular killing. So invasion, survival, spread is regulated by SPI, Salmonella pathogenicity island, via lymphatic. So it is going, it is residing, it is resisting, it is establishing its own lymphatic lymphatic control over the local region, as a result of which it invades the mesenteric lymph nodes. Via thoracic duct it enters the blood bacteremia. Okay, it's called as a transient bacteremia. When via the blood it goes into the liver to the gallbladder to the bone marrow, lymph node, kidney. Okay, so complete bacteremia, massive bacteremia is established. The time of invasion of the gallbladder is given by the massive bacteremia, whereas the thoracic duct invasion is is given by transient bacteremia. This gallbladder invasion is given by massive bacteremia. This gallbladder sheds into the intestine. Okay, this organisms sheds into the intestine again and into the Peyer's fracture. It causes necrosis and it causes the ulcer. Okay, it causes the ulcer. Coming to the different types of ulcer, again we have a transverse ulcer in a TB, flask shaped ulcer in Entamoeba histolytica, and aphthous ulcer and serpentine ulcer. Late in the initial stage we have aphthous ulcer, later stages it becomes bigger size into serpentine ulcer and Crohn's disease, and superficial ulcer with pseudo polyps. It's this is for, can you guess, it's for ulcerative colitis. Okay, these are the types of ulcer we have. Then coming to the incubation period, then why we started to discuss about ulcer is that because of the significant or maybe the massive bacteremia, the bacterial components are sheds into the intestine, into the Peyer's patches, into the necrosis. It causes the ulcer. Then coming to the clinical features, so clinical features, incubation period is 7 to 14 days. Fever is the stepladder fever, relative bradycardia, soft palpable spleen, liver size increases, rose spots, second to third week it fades on pressure. Okay, rose spots in the skin, that is very very important. Typhoid Mary, Salmonella typhi, typhoid Mary. So Mary Rose, so remember two girls name. Okay, two girlfriends name. So it's Mary and rose spot in skin. It is during you usually see her in second and third week, but it goes away on pressure. Okay, so that is the key point here. Then coming to the carriers, so carriers we know that sheds bacilli in feces and urine. Convalescent carrier 3 weeks to 3 months. Okay, so rose spot, for rose it's like a date. Okay, it's like a date during second to third week, whereas convalescent carrier, it's in beginning of an relationship stage, the 3 weeks to 3 months. Temporary engagement time, so temporary carrier means 3 months to 1 year. Marriage time is chronic carrier, more than 1 year. Okay, typhoid Mary in New York. So coming again, so we have the Salmonella typhi clinical features. We are seeing incubation period is 7 to 14 days. Fever, stepladder fever, relative bradycardia is very very important here, and soft palpable spleen and liver are also very very important. Podosplenomegaly is involved, and rose spots, initial dating, rose spot second to third week, but she goes away on pressure, and sheds bacilli carrier, she sheds bacilli in feces or urine. And convalescent carrier means it's like beginning of entering into a relationship 3 weeks to 3 months, and engagement phase is the temporary carrier 3 months to 1 year, and marriage phase is called as the chronic carrier, is more than 1 year. Then coming to the diagnosis, the diagnosis is given by Basu. So for this Salmonella typhi, Basu, so Basu is our hero name, and heroine names are Mary and Rose. Okay, Basu. So what is Basu here? So Basu week 1, A week 2, S week 3, and U week 4. Okay, B for blood culture, clot culture. collect blood. When it clot, it lyses by streptokinase, means better results. Okay, so got and blood culture or maybe the clot culture is studied in week 1b. And coming to the A, basu A, week 2 only antibody viral test is done. And coming to the week 3 means yes, so BAS week 3 it's for the stool culture. U for, as you guessed, it's for urine culture. Okay, it's for urine culture for the week 4. Okay, and in week 1 the blood culture is more sensitive than the bone marrow culture is more bone marrow culture that is more sensitive than the duodenal aspirate. Then coming to the enrichment broth, it is the one and the same. It's selenitive broth, tetrothianate broth. Selective media is XLD or maybe the DCA. Black centers due to the H2S production, Wilson and Blair medium. And Salmonella paratyphi. Then in Wilson and Blair medium, selective media, there is it's also in a differential medium and also in selective medium. Selective medium for the Salmonella group of organisms, and differential medium between Salmonella typhi and paratyphi AB. In Salmonella typhi, it produces jet black colony with metallic sheen. Okay, so it's more powerful now, it's more ancient Salmonella typhi, so it produces a jet black colony with a metallic sheen, whereas Salmonella paratyphi A and paratyphi B doesn't produce H2S, so it just leaves a green color colony. Then a few words about this Vidal test. So Vidal test, usually we take the sample in two acutainers, or maybe two types of acutainers are predominantly used in red vial and yellow vial. Yellow vial is as a clot activator gel, but red acutainer doesn't contain anything. Okay, so we are collecting samples in these two vials, and the principle being that the antigens we are testing is the H and O antigen. So antibody in the patient's sera is demonstrated by using O and H antigen. Okay, so the tubes, the serial dilations of the antibody in patient sera is demonstrated by O and H antigen. So in Salmonella typhi, mostly O can be it's not that very much significant. Con tubes gets used. Okay, con tubes are used, so OH you can have it as a mnemonic. Okay, and then coming to the this interpretation of the Vidal is very important here, because it gives which type of paratype, which type of the Salmonella typhi, paratyphi or paratyphi A or B, or maybe in the early infection or late infection, or maybe the vaccinated state is given by this condition. I will just give a hint here, you can just go and read in your books. The hint being that whenever the O antigen, the O antigen is a positive in an early infection, okay, negative in a late infection, just have it that way, and also negative in vaccinated infection. So when it is negative, we have to choose behind late or vaccine. So in vaccine, other three like T H antigen, H A paratyphi A H antigen, paratyphi B H antigen, T H and A H B H, we saw the H forms, no, that those becomes positive in the vaccine, so vaccine completed. In late, depending upon the strains we gave, it comes positive, so second also we give. Then coming to the next thing, when O antigen turns positive, and the infection has been differentiated between whether it is a typhi, whether it is an paratyphi A or maybe the paratyphi B, we will be having only O as positive, other three will be negative, but the concurrent portions will be positive, O positive, and the A for A positive, T for typhi for T positive, and B for paratyphi B positive for the other sections. Like that we can easily interpret. Just first initially whatever may be the question, however long may be the question, or maybe however short may be the question, first you have to see only the O antigen interpretation. So from that O antigen interpretation we can derive the answer. Then coming to the false positive, so false positive response is also called as the anamnestic response. So false increase in titer, if increase after 1 week also, okay, then it is an true, otherwise it is it decreases. How do we rectify this mistake is by repeating the titer again after 1 week. Okay, after 1 week, if the titer increases means it's true, if decreases means it's false. False positive, I'm just saying. Then coming to the new test, it is the typhi dot. So typhi dot and a dot blot. Typhi dot is by the outer membrane protein. Outer membrane protein is studied. IgM antigen. Antibodies against outer membrane proteins are studied in a typhi dot. In a dot blot, IgG antigen against flagellar antigen. So dot for outer. Dot blot is for the so dot blot is for the flagellar, whereas typhi dot is for the outer membrane. Okay, then coming to the miscellaneous diagnostic test. Miscellaneous diagnostic test by interpreting WBCs called relative lymphocytosis or neutropenia. Okay, relative lymphocytosis or neutropenia is seen. Coming to the biochemical, we already saw that for Yersinia we have only methyl red positive, I negative, M positive, V negative, C negative. But here we have IM, V, M, Vic, positive, negative. I mean negative, positive, I'm sorry. So it ferment. What does it interpret? It ferments glucose and also in fermentation of glucose, mannitol and maltose, as both acid and gas production is seen. In a Salmonella typhi there is no gas production. Okay, then coming to the few points about this IMVIC. In E. coli we saw that IM positive, VIC negative, Klebsiella everything is negative, only C positive, Yersinia as I said only M positive, other negative, in Salmonella negative positive, okay. So you just have this, write it somewhere and revise 2 or 3 times, it will come in handy after some time. Then we already said that there is an relative lymphocytosis or neutropenia there, okay. So it's a relative, not an absolute. Okay, then coming to the serotype by agglutination. Serotype by agglutination is by the serotyping is by the anti-serum. So National Salmonella Reference Center from the Kasoli. Bacteriophage typing. So bacteriophage typing is done in the Lady Harrington Medical College, Delhi, and in India Salmonella typhi phage A1, E1 and Salmonella paratyphi type 1 and type 2. Okay, these two are the phage being studied, and the treatment is the ciprofloxacin, drug of choice, and ceftriaxone if ciproflox is different, and in case of multi-drug resistant strains we follow chloramphenicol, ampicillin, trimethoprim, sulfomethoprene, and NAST, okay, naldixic acid resistant staphylococcus, and for in Salmonella typhi we use naldixic acid. Okay, then coming to the vaccines. So vaccines, we have a parenteral tablet, doesn't provide any cell mediated immunity. It was given earlier, but live oral vaccine, type oral vaccine, type oral 21, remember trisomy 21, like that 21A. So typhoid 21A, lacks enzyme UDP galactolepimerase. On ingestion, self-destruction in 4 to 5 divisions occurs and the immunity is established. It causes, as there is a self-destruction, there is no illness. And another vaccine is against the VI antigen, typhim VI, typhi 2. So 21 is for the oral vaccine. VI vaccine is typhim vaccine is type 2. Then coming to the live oral vaccine, it is given more than 5 years of age, booster after 3 years. Okay, that is the age. Then coming to the Salmonella gastroenteritis. So Salmonella gastroenteritis, so it's a non-typhoidal Salmonella. Okay, that is the key point here. So typhimurium, so Salmonella enteritis, that already first information I gave to you. So what is the source? Is the food from the meat or milk, incubation less than 24 hours, fever, vomiting, and usually supportive management only. Just for completion sake I have just added here. Just don't give any Salmonella gastroenteritis means only one information. Most common is the Salmonella typhimurium, non-typhoidal Salmonella. Non-typhoidal Salmonella, I am just repeating it again and again because it is repeated many times in the questions. Non-typhoidal Salmonella is a Salmonella gastroenteritis. So most common is the Salmonella typhimurium, Salmonella enteritis. Okay, enteritis. Okay, and then coming to the Salmonella septicemia. So septicemia, it causes myocarditis, it causes pneumonia, and it causes osteomyelitis. Fatality rate is up to 25%, and it is caused by chloratius. Okay, so we have just wiped out Salmonella also. Then coming to the Shigella, I know that it's a bit tiring and completely fact-based talking we are just doing right now, or maybe the one-side information I'm just giving right now, but I will just again post these videos again. Okay, like if we are just doing this as a first read, and in first revision, or maybe probably within few hours after the reading, or as a secondary recall method, I will be posting it again, but in a more shorter version. And then after a few months as an revision time, and also like successively I will be just guiding through the examinations. Okay, then coming to the Shigella. So Shigella, as I said, it's a very our student friendly, not no examiner friendly, only student friendly, because it is a non-motile accepted, non-sporing, non-encapsulated. Okay, then what is the infection dose? So infection dose is I already said, no, it is low infection. EHEC, Shigella, Intramoeba histolytica, Giardia lambia, everything low infection. So 10 to 100 low bacilli. So less than 100 itself significant here. So Salmonella, what are the species? Under subgroup A, we have Salmonella dysenteriae and Salmonella flexneri, most common in India. Salmonella boydi and Salmonella sone is most common over the world. Then Salmonella dysenteriae. Salmonella flexneri, boydi non-lactose fermenters, Salmonella sone. Sone is a late lactose fermenters. Okay, main fermenter is the mannitol and mannitol and catalase positive, whereas dysentery is catalase negative. Okay, then coming to the Shigella dysentery type 1. Shigella dysentery type 1, already I have said that it is fermentation negative, lactose fermentation, mannitol fermentation negative, and lactose fermentation positive, and catalase negative. Okay, catalase negative. Then coming to the catalase negative is very important here. Okay, because it is combined with the catalase negative non-motile strains. Klebsiella is also non-motile strain. No, Shigella is also non-motile strain, but Klebsiella, the Shigella is the Shigella dysentery type 1 is the catalase negative. I have just spoken in another video. I will just upload in few time. Neurotoxicity, enterotoxicity, and cytotoxicity. Enterotoxicity is the Shigella dysentery type 1 and Shigella enterotoxin 1 and Shigella enterotoxin 2, and cytotoxin is by the Shigella like toxin, so virotoxin of the E. coli. Okay, so virotoxin of the E. coli, decrease in ribosomes, decrease in protein synthesis. This is important here. Then coming to the Shigella dysentery type 2, it's also called as the Shigella Schmidt type 1 versus type 2. So it is indole negative, whereas the type 2 is indole positive. Type 1 is catalase negative, whereas type 2 is catalase positive. Mechanism is a Shigella mucosa entry via M cell, cell to cell. Then Shigella like toxin is an endotoxin, whereas the Shigella exotoxin type 1, exotoxin type 2, both everything spread by cell to cell, spread by the polymerization. Then diagnosis of Shigella for sample stool, enrichment broth and selection media is used. Transport media, Sachs buffered glycerol saline, and selective media is the DCA or XLD. Okay, enrichment broth is the salinate F broth, and then coming to the tribe Edwardiaceae, that's it. Okay, that's it. And I will just sum up few one-liners about other organisms under this Edward and Ewing classification. Tribe Edwardiaceae, Edwardiaceae la tarda. It is a weak fermentation of the sugar. Meningitis it causes. Though it is a weak fermenter, it causes meningitis. Contradictory points. Very hot spot for examiners. Then coming to the tribe Citrobacteriaceae. So Bharat Nagar strain VI antigens for Salmonella. Citrobacter diversus, Citrobacter friendly. So diversified friends. Citrobacter diversus, it produces H2S. Okay, so but whereas Citrobacter friendly H2S negative, that is the difference between these two. Though it is different, but the clinical features is the same. Both causes UTI, otitis media, utilize citrate, lactose fermentation is variable here. But the strain for Citrobacteriaceae family is the Bhatnagar strain VI antigen Salmonella. Okay. Then Yersinia. So first we saw about Edwardiaceae, that meningitis weak fermenter, and Citrobacteriaceae B for Bhatnagar strain. Then Citrobacter diversus frundi, H2S positive negative. Then features. Then coming to the Yersinia, tribe Yersinia. So Yersinia herbicola. So Yersinia herbicola, it produces the yellow pigment. It causes the UTI. Then coming to the Vibrio section. So Vibrio section, I will just I think this completing the first 3 sections itself took 40 minutes. I will just try to sum everything of the important Vibrio, and because we know Vibrio, it's already well known thing. So I will just try to extend to another 10 minutes, and I will just complete the Vibrio section. So family Vibrionaceae. So VAP, 3 forms, 3 organisms: Vibrio, Aeromonas, Placimonas. So this Aeromonas causes red leg disease in frogs. That is not important, but I found it. I found out it. I found it very interesting. And then coming to the plesiomonas, it is gram negative but oxidase positive. Okay, Aeromonas and Pseudomonas. Okay, then coming to the depending upon the salt growth and salt concentration, it can be Vibrio can be classified into halophilic and non-halophilic. So halophilic means it needs a salt 7 to 10 percentage. Vibrio parahemolyticus, Vibrio alginolyticus, Vagina vulnificus. Okay, whereas non-halophilic it cannot grow at high salt. Vibrio chloride, Vibrio mimicus. Okay, then Gardner and Venkatraman classification. Okay, this is very important classification. So Gardner and Venkatraman classification, Vibrio cholerae, others. Vibrio cholerae we have O1, O139, O2, 138. Under O1 we have a classical LTAR and LTAR variants. Under classical we have Ogawa, LTAR Inaba and LTAR variants Hikojima. Okay, that is the thing. Everything contains that LTAR and classical forms have O, I and H antigens, whereas Hikojima contains no Hikojima, no H, only O and I. Okay, then coming to the group, subgroup, serogroup, biotype, serotype. Okay, so it is a group. Vibrio cholerae is a group. Subgroup or serogroup is the O1, O2, 138, O139. Okay, then biotype is the classical LTAR or LTAR variants. Serotype is the Ogawa, Inoba and Hikojima. Okay, then this is the thing. And then coming to the differences between the classical form and LTAR form, it is very important. Remember, LTAR is supreme, so it is supreme and more powerful. Beta hemolysis, yes, it produces sheep chick erythrocyte agglutination, yes, positive. And the VP test is also positive, CAM test positive, polymyxin B and FH4 resistance, yes, it is resistance. Okay, so everything is supreme in case of a LTAR form. Then coming to the mortality of the with the secondary attack rate is more in classical. That is the only one classical epitome characteristic point under the classical Vibrio of the O1 of the Vibrio cholerae. Okay, it's more, whereas the carriers and subclinical cases are more in LTAR. No, mortality is not that much when compared with the classical strain. Then coming to the epidemiology is important task. In 1992 in Chennai, non-O1 outbreak, another O1 not O1 strain is isolated and responsible for causing the outbreak in Chennai. In 1993, O139 is a capsulated strain in Bengal outbreak. So in India, LTAR is producing more than classical forms, where in Rishikesh only classical is increased. In other regions of the India, LTAR is more. Then coming to the pathogenesis. So pathogenesis is the transmission by the food and water. Infectivity dose is 10 power 8. Okay, so out of these organisms, it has the highest dose of infectivity. Mucus layer is crossed by the mucinous enzyme produced by this organism. So intestinal epithelial adhesion, toxin core regulated by pilus. So it is adhesion, not invasion. Adhesion to the intestinal epithelium, not the invasion. Okay, this is one pathology and microbiology and infectious diseases question. So toxin co-regulated pilus, a TCP is used, and it is just others, and toxins are released by the mucinous. Like Shigella, the infectivity dose, can you remember? It is Giardia lambia, Shigella, Entamoeba histolytica, EHEC, everything. We had the infected dose to be 10 to 100, but here we have 10 power 8. Then coming to the cholera toxin. So cholera toxin is a bipartite toxin. So coded by the CTX gene. So fragment A and fragment B. Fragment A for action, B for binding. A increases CAMP, B increases GM1 ganglioside. Okay, then A1 subunit. So A1 1 subunit, B 5 subunits. B binds to the GM1 gangliosides on ileal mucosa. A increases CAMP, phosphorylation of CFTR, cystic fibrosis, transmembrane regulator protein. As a result of which, increased sodium, potassium, chloride, and water ions are secreted. So rice water stool diarrhea comes by the activation of CAMP by the action over CFTR. Okay, similar to cystic fibrosis mechanism only. Then coming to the clinical features, so sample is obviously the stools or maybe the rectal swabs, rice water stool, sudden onset of mucus flakes. Sometimes if usually order is so sweetie order, but no one is going to smell the stool here, but it is for theory purposes. So sometimes it's the fishy order, so non-pan pan sample needn't be taken. Okay, Then coming to the incubation period is 1 to 5 days. Reservoir is for the human, carriers shed and feces, and Yeltor is the more common for the carrier state, as I have discussed earlier. Then TCBS is the selective media or maybe the differential media, because it produces yellow colonies in TCBS, whereas the black colonies is produced by the parahemolyticus. Okay, then comma shaped growth is observed, and positive string test. So positive string test, the reason for the positive string test is the liberation of the DNA organism, bacterial DNA into the medium that only produces. This is positive string test. So reason assertion question here. Then coming to the lab diagnosis, transmit medium, we know that Carrie Blair and Venkatraman. See, that is typhoid Mary. This is Carrie Blair. Don't confuse. Okay, Venkatraman Ramakrishnan medium and Carrie Blair medium, and this curved. What is the microscopic examination? As I've said, fission stream appearance. Okay, so fission stream appearance, comma shaped and gram negative gram negative organism, and motility is by the darting or shooting star motility. Also with the Campylobacter also it produces same motility. Okay, then coming to the culture, McConkie agar non-lactose fermenting, rarely late lactose fermenting. Then blood agar greenish hemolysis, later hemodigestion, initially green, later complete hemolysis. Then nutrient agar translucent bluish tinge, nutrient agar only translucent bluish tinge, and gelatin stab, turnip or infundibular liquefaction is seen. In Bacillus anthracis, as I have said, bamboo, so downward direction, Clostridium upward direction, turnip in Vibrio color. Then enrichment is by the alkaline peptone water and wants taurocolate, tellurite peptone water, selective TCBS. So the TCBS, ABSA, GDTA. Just remember the name, no abbreviation is needed. For the TCBS alone, you have to remember the abbreviation. Thiosulfate citrate bile salt sucrose. Okay, it produces yellow color growth. Then black color in the GDTA. Black center and halo is produced. And coming to the biochemical test, everything is fermented here: glucose, mannitol, maltose, sucrose fermentation. Catalyst positive, oxidase negative, string test is positive. Okay, so the Vibrio, as I have stated, the damages DNA comes out, it forms the string. Treat sample with 5 for the string test. We have to treat the sample with 5% deoxycholate, it produces the viscous string. Then in under special reaction is the cholera red reaction. It is also called as the nitroso-indole reaction. So Vibrio plus alkaline peptone water rich in tryptophan and nitrate plus H2SO4 gives a red due to the nitroso-indole formation. Nitrate to nitrite reduction, and tryptophan is reduced to indole. The test for toxin is the Chinese hamster ovary cell assay and adrenal tumor gamma 1 cell assay, Vero ELISA and skin bluing test, and CT, and then cholera toxin intradermal given in animals, sky blue dye IV. Site of injection is the blue. Okay, blue color because of when a toxin is present on coming in contact with the dye, it produces blue color there. And vaccine, killed oral vaccine, killed oral whole cell vaccine, live oral vaccine. So classical Elter and O139. Okay, then treatment. So treatment on the primary treatment is the ORS. Secondary is one with or without IV fluid, that is the primary treatment. Secondary is only with the drug of choice is the doxycycline and azithromycin in case of children and pregnant women. And Vibrio mimicus in USA, seafood consumption grows best at low salt concentration. Then coming to the halophilic Vibrios, is also called as the group B Vibrios. So Vibrio parahemolyticus, Vibrio alginolyticus, it produces swarming growth. Okay, then commonly everything produces wound reaction. Vibrio vulnificus in healthy individuals, it causes diarrhea, and in HIV it causes cirrhosis and sepsis. So yes, conjunctivitis and otitis media and gastroenteritis is produced. Then most tolerant to NaCl is the alginolyticus, 10% NaCl. Okay, then okay, mobile forms peritrachous solid, monotrachous liquid, Kanagawa phenomenon, parahemolyticus. Okay, then lactose fermenters is the ulnificus. Then Kanagawa phenomenon. What is Kanagawa phenomenon? Anu, agar, suma agar, blood agar with 2 to 4% salt. Pathogenic strains are produced means it is hemolytic, and non-pathogenic strains are produced means it is non-hemolytic. Then comparative study between Vibrio parahemolyticus and alginolyticus, as compared between that elder alginolyticus very supreme, as it is resistant to even a 10% NaCl. Okay, so but 7% NaCl parahemolyticus also it can fight, but 10% it can't fight. So 10% it is negative in parahemolyticus, and swarming growth may or may not be present in parahemolyticus, but it will be completely present in alginohemolyticus. Then coming to the non-fermenters. Yes, yes. Just 5 more minutes. Then coming to the non-fermenters. So non-fermenters, under non-fermenters, we study about Pseudomonas, Burkholderia, and Acinetobacter. So Acinetobacter Bowman is a gram-negative Coccobacilli, MDR, and catheter-related bloodstream infection. Okay, catheter-related bloodstream infection (CRBSI) is studied. Acinetobacter Bowmani. Then coming to the Pseudomonas, attachment pili toxins, non-diffusible SUTI, SUTY, diffusible exotoxin A, elastase, protease, phospholipase, EF2, and a decrease in protein synthesis. Then virulence factor, exotoxin AB, decrease in protein synthesis, enzymes, proteases, elastase, other toxin, hemolysin, enterotoxin, slime layer, pili. Then coming to the pigments. So pigments when the pyocyanin, bluish green, only Pseudomonas aeruginosa, enhanced by king medium. Pyoredin greenish yellow, king medium. Pyorubin red, pyomelanin brown. Other species also. These are the pigments produced Pseudomonas. Okay. Then a slime layer for the protection, other toxins, hemolysin, enterotoxin, enzyme, protease, elastase, B decreases protein synthesis, resistant to it in burn words, it is resistant to Dettol, cetrimide, and antiseptics, susceptible to silver salts, silver sulfonamide, topical burn creams. That is the reason why we are giving that. Then what are the clinical features? It causes the pneumonia, burns, and green nail syndrome. Very important. And swimmer's ear and contact lens associated corneal ulcer, meningitis, and UTI. And from the name itself, we can derive that pigment enhanced by King's medium and a sweet odor and a fruity odor, and EE for large opaque colonies in metallic sheen, and use sugar oxidatively, and McConkey non-lactose fermenter, very important, motile organ, and agar beta hemolysis, and selective media cetrimide agar. Okay, then coming to the blue green pigment, diffusible pigment, and it is on microscopic examination gram negative, motile polar. Okay, then E test antibiotic sensitivity is done. Then coming to the Burkholderia, also demonstrate Pseudomolai, malai, and Capacia. Burkholderia, Pseudomolai, safety pin appearance. Then Pseudomolai, lung and skin ulcers is produced by Pseudomolai and malai forms, whereas Cepacia, it is the most common cystic fibrosis it causes, and granulomatous diseases, it is the most common granulomatous and most potent. And Cepacia, so Cepacia means it is antibiotic resistant also, it produces. Pseudomolai, it causes melioidosis, it is also called as a glandus like, associated with bioterrorism. So Yersinia pestis, Clostridium botulinum, and Pseudomolai, Burkholderia Pseudomolai bioterrorism, and whereas malai on the Strauss reaction inoculate into the guinea pig, and testicular swelling is studied, and glandus in equine animals. Okay, then coming to the Pseudomolai, melioidosis, Vietnam time bomb, as I've said, it's a bioterrorism agent, safety pin appearance with methylene blue, gram negative, selective media, ASA, ash down, so bomb ash, so ash down selective media, so gentamicin and crystal violet to decrease other bacteria, and Pseudomolai, it is resistant to polymyxin B, it is a non-fermenter, it's a bomb. Okay, then carbapinum and imipinum is given. So I have just rushed the facts in these four organisms, and we have just come to the end. But we have to do this session again and again. I will be just it took for 53 minutes right now, and I will be just doing it again, so that like after spaced repetition technique, by I will just see whether it will be this information can be brought back or not. By within another 6 to 12 hours, I will be just posting another video, and we will just see whether how long it sticks and how long it takes to stick. Okay, all the best. Thank you.